Texas hospitals are preparing for significant cuts to billions of dollars of federal Medicaid funding as part of a budget proposal introduced by the House Republicans recently. The proposed cuts could cause severe financial strain for hospitals and negatively affect the quality of care patients receive, particularly for children and individuals with disabilities. Joining us now to tell us more about the potential impact of these cuts would have on Texas hospitals is Darbin Wofford. He's Deputy Director of Health Care for the nonprofit Third Way. Darbin, welcome to the program.
Hello, thanks so much for having me.
Okay, we can talk about this theoretically or we can talk about it practically. Let's jump in it practically. What could these cuts mean for our area and for Texas hospitals?
Yeah, absolutely. So starting off nationwide, Republicans are pushing forward a plan that would slash at least $715 billion in total healthcare spending. That means massive cuts to Medicaid, which is a program that covers nearly 1 in 5 Texans, including children, seniors, and people with disabilities. And why are they doing this? They're doing it to pay for tax cuts for the wealthiest of Americans, because with tax cuts, they need to find a way to offset that money. So they're choosing to take it from people's healthcare. And to put this a little bit more in perspective, this would mean next year a $1.8 billion cut to Texas in year one. So that's nearly $20 billion over the 10-year budget window, or a 9% cut.
Let me stop right there for 1 second. And you talk about these cuts to Medicaid. And if I'm not mistaken, the president recently was heard saying, don't touch that, don't touch that. But mathematically, if I understand correctly, and we've talked with other representatives here on this show about it, you can't put the cuts you're proposing to budget lines without touching these programs. Is that accurate?
Exactly. The committee that was in charge of finding $880 billion, the biggest piece of their budget is the Medicaid space. So it would be impossible to get the numbers they're looking for without significant cuts to Medicaid. And even though the president will say, do not touch Medicaid except for waste, fraud, and abuse. Now, the key word waste there, anything Republicans do not like in Medicaid, they'll call waste. So that will fall in President Trump's definition.
Darbin, this would also include the SNAP program, wouldn't it? Also, I guess people know as food stamps in the old days. So what I think we hear about Medicaid, and we just hear it's health care for poor people, right? So what exactly are we talking about with Medicaid? Hospital care, prescriptions, doctor care, prenatal care, psychological care. What does Medicaid bring to people that are below the poverty line?
Yeah, so Texas covers, or Medicaid in general covers about 20% of all hospital care. So even if you're taking away coverage just from lower income Americans, those hospitals are still going to see that impact in those massive revenue losses. So it's going to affect people not just on Medicaid. Take nursing homes.
Mm-hmm. Well, I've always heard that even if you're on Medicare, if you're in a nursing home long enough, you're going to end up on Medicaid. I mean, that's just the way it is.
That's completely right.
Yeah.
So take me back
to
the earlier question. So tell me exactly how we would feel these. Give us practical examples of what would have to happen if these cuts happen the way you say.
Mm-hmm. So a 9% hospital cut is going to mean, in practical terms, that they are going to have to scale down on the services that bring in the least amount of revenue. Maternity care, for instance, is an area where hospitals don't make as much profit on delivering and caring for babies. So we're going to see those services scale down, creating deserts for maternity care. Or if a rural hospital is struggling already, they might have to close down. And I was going to note earlier, about 63% of people in nursing homes are covered by Medicaid. So if nursing homes lose a bunch of money because of these Medicaid cuts, that's going to mean cuts in staff, which is going to mean lower quality care for people, or even closures.
So Darbin, President Trump said today, quote, "We're not doing any cutting of anything meaningful," unquote. And that is, he said that earlier today. He said the only thing we're cutting is waste, fraud, and abuse with Medicaid. Can you give us any examples of perhaps where there is some waste, where we could lean out and not have huge impacts on people within that need it most?
So there are a couple of more technical pieces of these Medicaid cuts. One area that does kind of fall in that bucket. It's hard to pretty much all of this is putting increased paperwork burden on people. So even if program integrity means well in trying to make sure that people on Medicaid are eligible, what it does is it creates a paperwork burden for people who are eligible so they can miss a deadline or not get an envelope in the mail regarding their eligibility paperwork.
But could you
so
tell
even
us
if the policy
a little bit about where you were about to mention some of the examples where where we could look at logistically, we could slim down a little bit of the area?
Yeah, so one specific policy that necessarily I think does fall into this bucket is called state-directed payments, where hospitals are now permitted to pay up to the commercial rate for hospital care, which is astronomically higher, over 300% of what Medicaid pays for the same services. And in recent years, there's been an increased ramp up of that hospital care. Some might say it's considered an overpayment. So that's one area where this bill does crack down on states' ability to pay hospitals significantly more than is necessarily needed.
But you're implying that the hospitals are overcharging to begin with.
Right.
It can depend. There can be wealthier hospitals that get plenty of money from primarily treating people with commercial coverage, and they're going to be fine. It's the hospitals that are treating a higher number of people who are either uninsured, on Medicare, on Medicaid, that are going to bear the brunt here. And those are your safety net hospitals or those in rural communities.
Darbin, let me ask you this then, because we all know that there needs to be cuts in budget. There needs to be reeling in of spending. And those of us that have experienced times in the hospital with loved ones or ourselves know that the costs are very high for things that out on the street would cost a lot less. Where is, or how do you find the balance in this? What is the solution to continuing to give in this country, the richest country on the planet, good health care, but keeping it within cost? Is there a way to fix this? And if so, what would be your plan?
Absolutely. I think number one, Medicaid is not the place to look if you're looking to ramp down on high healthcare costs. Medicaid is already by far one of the most efficient government healthcare programs in the country and already pays below what it might cost a hospital to provide services. One area that we should be instead looking at is the high price people pay through commercial insurance, because people with private insurance often pay 3 times the cost of what Medicare pays for the same services, and they're the ones with the high out-of-pocket costs, high premiums, high deductibles that are really struggling. In Medicaid, historically, it's not necessarily affordability that's the issue, it's access. So if you're just cutting down spending in Medicaid, that's not going to fix the problems of access that we already have in Medicaid. It's going to make it worse. So for dealing with costs, we should look for to lower costs for people with private insurance.
Darbin Wofford is the Deputy Director of Healthcare for the nonprofit Third Way. Darbin, thank you so much for joining us today on Hello Houston.
Thank you.